the massage of the back region. Okay. First, arrangement of pillows is really very important for the patient. One is under the abdomen. This is because you relax your spine. Actually, it is lordotic spine. So you should relax it by keeping the pillow under the abdomen. Okay. Next pillow is under the lower leg, which is exactly at the ankle joint. Okay. And another pillow can be placed or cannot be placed. It depends upon the couch. So because you should make the patient to breathe. Okay. This was position of the patient. Position of the therapist, box standing, with removing all the ornaments, watches, etc. Okay. Next, coming to the back, it has 8 techniques.
8 techniques.
Total it has 8 techniques. Back region has 8 techniques. Coming to the 8 techniques. सबसे पहले stroking. First is superficial stroking. This is done with a lighter pressure. So it should be covered for all the aspects of the back. So see that the contact is maintained throughout the massage. Okay, this was superficial stroking. Next is FUR. It has 3 main regions. First is exactly at the posterolateral side, starting from the posterolateral side and ending at the axilla. Next is at the mid region of the back, starting from there and coming at the trapezius level and ending at axilla. The final third stroke is exactly at the middle of the spine and ending at the supraclavicular area. Okay. Next, this was FUR. After this, we have ironing. Ironing is also called as reinforced kneading, which is done with 2 hands upon one another. So this is like this. It should be done in a circular manner with 1 circle compression with 1 circle relaxation. Half of the circle is compression, other half is relaxation, and you should move it in a zigzag manner. Zigzag, starting from lower or from the upper, any side you can start it. But thing is that compression and relaxation needs to be maintained throughout the massage. See that the circles are not very large enough. It should be in a clumsy manner. This ironing ends at the scapular region. Okay, this was ironing. The next technique is palmar kneading is not there. It's finger pulp kneading or fingertip kneading. So this should be, first you should check the spines exactly parallel to it. You should start doing it. You can start either from the upper part, proximal to distal, or distal to proximal. So I am doing from proximal now. So only the pulp of the fingers must be used. One phase, one part of the cycle you are compressing, the other part you are relaxing. This is very, very important while you are doing this technique. Another main thing is, this was fingertip kneading. You can also do it for the spine. First you should check out the spinous process, and you can do thumb kneading also. It's another variation for fingertip kneading. Okay. This covers even the vertebral muscles, paravertebral and prevertebral muscles. Further see should identify the spinous process of the vertebra. See, this is the spinous process of vertebra. So by seeing that, and the kneading should be given around the spinous process. So one phase consists of compression and other is relaxation. While you are relaxing, move to the next circle with very light pressure. In one phase you are applying pressure, in one phase you are just applying light pressure. See, I am compressing and I am releasing and I am moving to the next circle. This should be done in a rhythmical manner, not in a faster manner. Rhythmical. Only the pulp of the thumb should be used, not the tip of the thumb. So the next technique is skin rolling. Okay, skin rolling, you can divide the entire back into halves. That is exactly at the spinal level, or you can do completely. I am doing it half. Okay, so check out the skin rolling. You should take it from the posterior, exactly at the posterior aspect. Starting from the posterior aspect. See, this distance is to be maintained. The skin should be rolled. It should not be catched enough. See how the skin is rolling. And it depends upon the bulk also. At this time, the position of the therapist can be changed. It can be to stride standing. This was for this half side of the spine, and to do the entire back, you can proceed like this. And you should come back from here. See that you apply intermittent pressure, not that forceful pressure. Okay, fine. Okay, we should proceed on like this. This was skin rolling. Next technique is hacking. In the hacking techniques, mainly the striking of the fingers is very necessary. So first three fingers, it can be done from the entire back. This sound is to be must while giving this technique. Covering the entire back. Position is very important. The ulnar sides of the three fingers should strike the skin. It's like this. And the sound produced is like this. It should be in a circular fashion. Okay, this was hacking. Next is beating or else pounding. Both can be done. You should strike this aspect from middle phalanx till the distal. The area should be struck off. In this, the flexion and extension of wrist is very necessary. This is the position of the hand. Only this, from the middle phalanx to the edge, this area should be struck to the back region. To see that only flexion and extension of wrist is done, not that you apply the whole body weight. And this sound is produced while you are doing this. It should be in a fast mode. Okay. Next is pounding, beating or pounding, anything can be done. So I will show you the technique of it. It should be coming from distal aspect to the proximal aspect. It can be done with one hand or both hands like this. Coming from lower to upper and upper to lower. Okay, these are the main techniques for back massage. Apart from this, you have other techniques which is necessary for your mastery of the skills over the massage. Before that, there are only, I will show you the following techniques. First is clapping. Clapping is done with cupped hands. Only this part should be striked off, not this part. Okay, and in this the flexion and extension of the wrist is very necessary, not that you just apply body weight. And see that the tip of the fingers does not strike, the body part. Okay, so it's like this, and the sound is unique. This sound is must, covering the entire back. Okay, this was clapping. After that you have other two techniques, vibration and shaking. In the vibration, it's anterior-posterior direction. The vibration, exactly at the middle, you are placing your hands and only your muscles should contract. That is called as co-contraction of both your extensors and flexors of your upper leg. So, only